you have feeling numbness or tingling sensation in your finger, especially at night. In today's video I'm going to explain you two main reasons why you have all those sensations, and of course I'm going to give you my Mario Rub protocol that really can help you in the safe and natural way move those sensations. And number one reason why you have all those problems is going to be your cervical spine. Let's talk about something that is called cervical spine connection. And this is one of the most common causes that is ignored. The cervical spine, your neck. Inside your neck you have vertebrae, bones stacked on top of each other. And between them there are discs. And coming out from the side of that is the nerve roots. Those nerves travel from your neck, under your collarbone, through your arm print all the way down to your fingers. This is like a garden hose. If you step on one of those hoses at the source, the water stops flowing at the end. Because our modern life, looking down at the phones, sitting at the computers, we lose those natural curve on the neck. And this puts massive pressure on the discs, and disc bulges and touches the nerve. And now here's the important point. Depending on which finger is numb, we can often tell exactly which disc is the problem. And in our neck we have 7 vertebrae, and this is a spine that is all connected with our arms. So if you have the pressure somewhere in maybe section C1, C2, C7, we know exactly when you have tingling, maybe little finger in your thumb, whatever, that we can point directly on our nerves here. So one of the main most ignored problem is going to be your neck and your pressure on the neck nerves, that you have all those tingling sensation in your arms. Second is going to be peripheral neuropathy and the starving nerve. But I'm going to give you another information. What if it is not neck? What is peripheral neuropathy? This is a scary term, but let's simplify it. Peripheral neuropathy means the nerves at the periphery, at the end of your body, like hands and feet, are dying. They are damaged. And why does this happen? And the most common cause doctors talk about is diabetes. And high sugar acts like a broken glass in your blood vessels, destroying the tiny capillary that feeds the nerves. When the nerves does not get the blood, it does not get oxygen, it starts to scream. And that scream is burning, tingling, or pain that you feel. But here's why they don't tell you. You don't need to be diabetic to have neuropathy. In many cases, numbness is severe vitamin deficiency problem. Of course, you can have diabetes on those later stages. You have peripheral neuropathy, and that is also one of the major reasons. But there is something unbelievably important. It's going to be chronic deficiencies, especially B vitamins, that you don't realize it, that you have them, and you have all those tingling, needling sensation in your arms. The nerves are covered with a protective layer called myelin sheath. Think of it like a plastic insulation on an electric wire. If this insulation is broken, the electricity sparks. This is the tingling you feel. To build the insulation, your body requires specific nutrient. And if you are deficient in vitamin B1 thiamine, vitamin B12, or vitamin B6, your body literally cannot maintain the nerve structures. And the insulation dissolves, and the nerve becomes exposed and hypersensitive. And very often medication causes this. If you take medication for acid reflux or diabetes, or whatever kind of chemical medication they use each day, it can destroy those vitamin B complex in your body, many other problems. This is especially important for you, my dear viewers, who have all those tingling sensation, but especially maybe a couple of years before you are diagnosed with high blood pressure, diabetes, or whatever problem that you have, and you use 2, 3, 4, 5 medication each day. All of those chemical medication that you drink for the months, for the years, I promise you they have the side effects, and one of those side effects can be nerve damage, my dear viewers. This is what I see each day for the almost 30 years. So how do you know if it is the neck or neuropathy? I will give you a simple guide. First, look at the distribution. If the numbers is in both hands exactly the same, at the same time this is often suggests a systematic metabolic issue, like neuropathy or vitamin deficiency. It is unlikely you have exact the same mechanic pinched nerve on the both sides of the neck at the same moment. Second movement, if you move your neck, if you look up, you look down, or tilt your head to the shoulder, and the electric shock travels down your arm, or numbness changes, that is mechanical neck problem. This is the spine. And third is timing. If you wake up with numb hands, but you shake them out and goes away in 5 minutes, this is often circulation or position or posture. But if numbness is constant 24 hours or most of your day, this is going to be systematic change, probably peripheral neuropathy, diabetes, chronic deficiency vitamin Bs. Did you understand me, my viewers? Those couple informations really you don't hear about your doctors. Usually you just take a make-up pill and everything's perfect, right? Wrong, my dear viewers. Now I'm gonna give you solution. And the most critical vitamin here is vitamin B1, but not just any B1, you need fat-soluble form like benfotiamine. Standard B1 is water-soluble and does not penetrate to the nerve layer easily, and benfotiamine does. It restores the energy production inside your nerve cell. Please write this down, my dear viewers. If you have those tingling sensation, you have nerve damage, you really need those benfotiamine. You can find them easily right now in your online healthy store. Search for benfotiamine. This is first step. Second step is gonna be vitamin B12. But please do not use Methylcobalamin, which is cheap synthetic form found in multivitamins. You need Methylcobalamin. This is an active form that your nervous system can use immediately to repair the myelin sheath. And add alpha lipoic acid. This is powerful antioxidant that improves blood flow to the nerves and reduces burning pain. Vitamin B1, vitamin B12, alpha lipoic acid. Of course, you must start practicing something called intermittent fasting. You must eat healthy. You must have healthy daily habits, and with proper nutrition, with perfect natural remedies, really can help you. But I want to give you a couple more information. This is about hydration and electrolytes. Your discs are filled with water. If you dehydrate it, the disc become flat like a flat tire. They cannot cushion the vertebrae. You must drink enough water with sea salt or electrolytes like magnesium and potassium. Magnesium relaxes the tight muscles in the neck that are compressing the nerve. And when people apply this correcting mechanism of the neck, the floating nerves with the right B vitamins, the results are incredible. The tingling stops, the grind strength returns, you sleep through the night without waking up shaking your hands. But of course, my dear viewers, this will not happen overnight. This is talk for the, I don't know, like for the babies. You think I will use maybe a couple days, 7 days, 10 days, 2 weeks, those vitamins, I do not feel better because they does not work. Wrong, my dear viewers. Healthy way of living, healthy lifestyle, nutrition, natural remedies, you must take them for the rest of your life. This is nothing something to play around with. If you think that you can just like that fix your chronic nerve problem, I believe you are wrong, because this is my specialty. This is just couple information what I use with my patients in my program of nutrition and natural remedies. And if you have any kind of nerve damage, any kind of chronic disease with your spine, hand, whatever, you can call my office and I will give you solution with Mario Rab protocols how we can be healthy again in the safe and natural way. You can call me from any country in the world. I'm here to help you. My name is Mario. I am European medical professional with over 26 years clinical experience working with the patient all around the world. My core expertise include nutrition, natural medicine, physical therapy and rehabilitation. Through my Mario Lab natural healing programs, I have helped thousands of people every year improve their health, regain mobility, reduce chronic pain and chronic diseases, and restore the quality of life. And those programs may help you as well. If you would like to visit my clinic in person, or if you prefer my personal phone consultations without traveling, my team and I are here to help you. Contact us via Viber or the WhatsApp at the phone number +385 98 9179 200. Your health deserves serious, professional, and individual approach. Thank you for following me. See you next time.